Hello, my name is Angela and I did my informative speech on diabetes. Do you know what the 7th leading cause of death in the United States is? According to the Diabetic Association of America, complications from diabetes claim approximately 70,000 American lives every year. In 2007, 7.8% of the population had been diagnosed with diabetes. The number of newly diagnosed diabetics is on the rise. I would like to tell you a little about diabetes because the best way to protect yourself from this disease is to be informed about it. Today, I will tell you exactly what diabetes is, the 3 types of diabetes, and the different ways diabetes can be controlled. By the end of my speech, you should have a better idea of why this disease is such a relevant topic and what you can change in your life to help prevent this disease from affecting you. Although diabetes is prevalent in the United States, most people do not really understand what it is unless they have been directly affected by it. Diabetes describes a group of metabolic disorders that are characterized by high blood glucose concentrations and disordered insulin metabolism. This means one of 3 things. Either the pancreas has stopped producing insulin entirely, it does not produce a sufficient amount of insulin, or the body's cells no longer respond to the insulin that is produced. You may be wondering, what is insulin and why do we need it? Well, insulin is a hormone produced by the pancreas that regulates the amount of sugar called glucose in your bloodstream. Insulin is used to move the glucose into cells where it can be used as fuel. If insulin is not being produced or the cells of your body are not responding to the insulin, the result will be an elevated glucose level in the blood, which may cause serious complications. Some of the risk factors for developing diabetes include family history, obesity, diet, age, and a sedentary lifestyle. There are 3 types of diabetes: type 1, type 2, and gestational. Each type has different causes and affects the body in a different way. In this speech, I will be concentrating mainly on type 1 and type 2 diabetes. Type 1 diabetes, commonly referred to as juvenile diabetes, is the least prevalent and only comprises about 5 to 10% of all diagnosed cases. In most cases of this type of diabetes, the individual inherits a genetic defect which causes their pancreas to stop producing insulin entirely. It is usually diagnosed in young children, but can also occur later in life. Type 2 diabetes, also known as adult onset diabetes, comprises 90 to 95% of all diagnosed cases. The cause of this type of diabetes is unknown, but it usually occurs in people who are overweight and physically inactive. In this type of diabetes, the pancreas still produces insulin, but it either does not produce enough insulin or the body's cells have become resistant to the effects of the insulin. The 3rd type, gestational diabetes, occurs only during pregnancy and disappears after childbirth. The cause is currently unknown, but women who have this type of diabetes have a much higher risk of developing type 2 diabetes and cardiovascular disease later in life. Although diabetes is a very serious disease, there's good news. During the last decade or so, there has been extensive research done on diabetes, and there are many ways to control it so that people who have diabetes can continue to lead a normal and active life. The most important thing for people with diabetes to do is monitor their blood sugar. For some people, this may mean checking it before and after every meal, but for people who have a better control of their diabetes, it can be done less often. Checking your blood sugar is simple, easy, and can be done practically anywhere. Doctors also use a blood test called a hemoglobin A1C, which measures a person's average blood glucose over 2 to 3 months. Diet and exercise are also very important for people with diabetes. A consistent carbohydrate intake that is spaced evenly throughout the day can help maintain an appropriate blood glucose level. Exercise is especially important for people with type 2 diabetes. A weight loss of only 10 to 20 pounds can improve insulin resistance. While diet and exercise are very beneficial to people with diabetes, on their own, they're usually not enough to control blood glucose levels. That's why most people who have diabetes have to take either an oral medication, insulin, or both. Because people who have type 1 diabetes cannot make their own insulin, they must be given insulin injections 1 or more times each day. Another option for insulin-dependent diabetes is an insulin pump, which delivers a steady flow of insulin throughout the day. There are many oral medications available for people with type 2 diabetes. These medications, called oral hypoglycemic drugs, help by lowering the amount of glucose in the bloodstream. People with type 2 diabetes may need to take insulin in addition to oral medication. In this speech, I have told you what diabetes is, the 3 types of diabetes, and the different ways it can be controlled. Although there is currently no known way to prevent type 1 diabetes, most cases of type 2 diabetes can be prevented with a few simple lifestyle changes. Eating healthy foods, exercising, and keeping your weight at a healthy range can help prevent not only diabetes, but many other serious health problems. I hope that my speech has shown you how serious of a disease diabetes really is. I believe that through diabetes awareness and education, we can eliminate it from being one of the leading causes of death in the U.S. Thank you.